please do throw questions to either the whole panel or to individuals on it on the Facebook Live chat, and then I will take as many of those as I can. So as I say, this is a new series that we're running. I hope you'll be able to join us for subsequent discussions, which will look into issues like the relationship between America and China. This series has been supported by the Singapore Global Network, which is part of Singapore's Economic Development Board, and so we're very grateful for them. Now, with that, let me introduce our panelists, speaking in the order in which they will be appearing. Beginning, we have Professor Ying, who is the Dean of our Public Health School here at the National University of Singapore. Secondly, after that, we have Joanne Jung, who is a visiting professor here at the National University of Singapore, also associated with the University of Southern California, and the founder of Research for Impact, which is a local social enterprise. And then bringing up the rear in speaking order, although not in any other terms, our own Professor Tiki Pangestu, who is a visiting professor at the Lee Kuan Yew School and also a former director at the World Health Organization in Geneva, and therefore has been one of Singapore's leading experts on the crisis as it's unfolded. So that's what we're going to do. I'm going to turn to each of my panelists to give an introduction for 5 minutes or so, and then we'll turn to discussion and to your questions. So if I could start with you, YY, and I'll hand the floor over to you. So thank you very much for joining us today, and I think this will be a great discussion. Go ahead, YY.
Right, thank you very much, James. Thank you for having me. So what I will do is actually just spend about 5 minutes to talk about the situation in Singapore, and then I'll pass it on to my fellow panelists to really explore the situation, both economically and globally. I think Singapore, we saw our first case of the coronavirus enter Singapore on the 23rd of January, and that started effectively the first wave that took us all the way until about the middle of March. And I think globally, there's been the recognition that Singapore did pretty well for the first wave. But right now, what Singapore is currently facing is actually the second wave that has been seeded by importations, primarily from returning travelers coming back to Singapore. And some of them come back with the infection, and that has subsequently seeded a fair degree of community transmission. So that's the first point I wanted to make, that we are starting to see the second wave in our current epidemic in Singapore. The second point I wanted to make, it's really the current numbers in Singapore stands at slightly less than 3,000 cases confirmed with the RT-PCR test. But beyond this figure of 3,000, what is more striking is that about half of them actually emerged only in the past 6 days. So you could think of from 23rd of January all the way up to this point, minus the past 6 days, that accounted for about half of the 3,000 cases. And within the past 6 days itself, we had almost 1,500 cases. And this is really a hallmark of the coronavirus epidemic that is spreading in many countries. Things can change very quickly. Within a few days, you could suddenly see an explosion of cases that happen within a geographical region, and in our instance, in the country. The third point that I wanted to make is related to this number of confirmed cases that we are seeing in Singapore right now. Because in Singapore, we are fighting the battle on two fronts. One is actually in the community, and one is in the dormitory involving our foreign migrant workers. In the community, we are seeing transmission that is somewhat manageable, and there are encouraging signs to suggest that the situation in the community is actually currently being managed pretty well, with an existing circuit breaker that is very much the equivalent of a workplace and a school lockdown with a certain degree of movement restrictions on individuals. We are actually pretty optimistic that within the next 1 to 2 weeks, we will start to see that the community transmission will be very much managed and in order. But what is worrying is actually our second front. The second front involves our migrant workers that has been contributing to the growth, to the development of Singapore as a nation for the past many years. And right now, there are a number of dormitories where these migrant workers are living in, where we see widespread transmission in some of the worst affected dormitories. Some of these dormitories house up to the order of 25 or 25,000 foreign workers. And you could imagine if we are unable to manage this situation, the transmission at the dormitories will be quite problematic for the country to manage. So the two fronts that we have, the dormitories as well as the community. And I suspect later on we will have a number of discussions that will focus on some of these points. But at this point, I will end off by saying that Singapore is amongst the first few countries in the world to see the second wave. Other countries include China, include South Korea, and Japan, where they are also seeing the second wave. But what we have seen in the dormitories is really an important reminder and warning to other countries out there, particularly poorly resourced countries, particularly low and middle income countries where there is a larger congregation of people, perhaps living in informal housing arrangements where human density is much higher. What we see in the dormitories could be a similar situation in some of these countries. And that is something that I hope at some point in today's webinar, we will have time to focus on and to discuss. But with that, over back to you, James.
Okay, thank you, YY. That's great. This issue of the second and third waves, and in a sense where the crisis moves from here, both in the advanced industrial societies and in the developing economies, is something that I would like to turn to in our discussion. But let me move to Joanne Jung and let you bring in both the economic and broader perspectives. So have your opening statement. Thank you.
Thanks very much, James. I'd like to, make a statement from the point of view of what we think now with respect to what we think of as more traditional economic policy, and then make a few remarks about what behavioral economics can tell us about the situation. So I think when we look at the economic paradigms that we have taken for granted for the last 10 years or so, today what we're seeing is a radical remaking of how we work and how we live with the support of technology. It's amazing that we're able to work from home. Well, as someone with small children, I'm never able to work from home. But digital technology is really helping us extend our work lives and to support some of the health and surveillance solutions that are really helping us to manage this crisis. But on the other hand, a lot of the way that we live now is exposing these vulnerabilities in an unprecedented way. So we are rethinking at the highest level some of our assumptions about globalization and what that means, and the risks that are inherent in some of our supply chains. I think YY has already touched on very meaningfully what the flow of migrant labor means for us. At other levels in society in Singapore, we're now seeing that the plight of gig economy workers is something that we need to be concerned about. But also from a social perspective, what we find is that we have many individuals that we've spoken out for many years who have very poor financial literacy, have very limited rainy day funds, SMEs with only 1 or 2 months cash flow. And even in a high income country, I think what we're learning now is that social protection is very limited. So distancing, for example, is a privilege of the people who can afford to stay home, who can leverage the situation, who have reserves. But at the same time, we have vulnerable pockets of society, even in a country like Singapore, that at the end of the day are basically the weakest link in our entire system. So what, from an economic point of view, this pandemic has shown us is risks and the assumptions that underlie what we have come to think of as our way of life. What behavioral economics tells us is that learning how to live with that risk or really understanding that risk is very problematic, right? In the environment of this pandemic, the psychology of fear and panic really drive us in many ways to our worst selves. What behavioral economists know is that we're very bad in general as a human species in thinking about risk and uncertainty. We're very bad at thinking about objective data. We're vulnerable to fear, to emotion, to affect, to a scarcity mentality. And what that does is that it triggers us in many ways into what we think of as system one thinking, right? It makes us myopic. It helps us focus only on the short term. It reduces our ability to empathize with each other. And it leads us to behavior like panic buying, which we know when we are our better selves is not the right thing to do. The other thing that we know is that we're very good at confirming what we already think. And so a lot of what we find is that in an atmosphere of pandemic, we basically are not able to process information in a rational way. So we take in information about the world, we take in information about things that we read, we take in information from our policymakers, and we process it in a way that conforms to what we already believe, or which exacerbates our existing biases. And that makes it very challenging for us to communicate in a rational way and to help people to actually follow through on policy decisions at the highest level. And last but not least, behavioral economists know that people get tired. We have such a thing as decision fatigue. And so even though we put into place things like social distancing that we know are good for us, over time, as people go on, our ability to conform to these things that we know to be important for the long term degrades as we get more and more tired. And so when we're in a pandemic situation, the traditional sort of rational model of how we make decisions breaks down. And I think part of what we're seeing now in Singapore and in other countries around the world is a period of learning about how we escape this narrow framing of pandemic, about how we live with uncertainty, about the fact that when we think we're done with the first wave, there'll be a second wave, and there'll be a third wave, how to manage this, and how to understand that there's not just going to be economic costs, but psychic costs. And the third point I'd just like to make is that the lesson I think that Singapore and other Asian countries and countries around the world are teaching us is that there are institutions and social compacts that actually help us overcome this, help us to become our better selves. We can think about health systems that we need to strengthen, that are integrated across social and health dimensions. We can think about new paradigms of leadership, the importance of crisis communications, about evidence, about transparency, about messages of empathy and solidarity. All of this, I think, are lessons that we are learning very quickly, and I hope actually stay with us. I mean, I like to paraphrase YY, actually in one of the previous things that he said, which is that in a situation where we can't follow clear instructions, there's only so much that policy can achieve. And what we're learning now is that for social reasons and economic reasons, there are people who can't follow clear instructions, but also for very deep psychological reasons, it's very challenging for us to do so, even when we can. And so I think all of these things are lessons on how to govern that we're going to have to learn very quickly as time goes by. And back to you.
Great. Thank you, Joanne. That's terrific. I should say that I'm looking, so we have some questions coming in, so I appreciate those of you who've left questions on the chat. We have a question about Taiwan and why Taiwan has managed to do so well. Would it have made any difference if lockdowns were sooner? Also one about the Singapore dormitory. So I'll come back to these questions, and please, any of the rest of you who are listening who have questions for our panel, do put them in the chat now. Let me turn now to Tiki. So you have an unusual background. You know public health very well, but you also used to work for a long time at the World Health Organization, and so have a good sense of this from a global perspective. So give us your sense of, in a sense, where we are and where you think this is headed.
Thank you very much, James, for this chance to frame my comments in three areas. The first one is what do we know at the moment? And what we know is the following, that the epicenter of the pandemic is now in Europe and North America, which has now about 66% of the cases and 80% of the deaths, although we are seeing some stabilization at the moment. The next item is that the countries are at different stages of the pandemic and implementing different strategies to contain it. You have on one end the very severe lockdown strategies such as in New Zealand and in India. On the other end of the spectrum, you have countries which are quite relaxed about it. Sweden is one example where they're taking a very sort of laissez-faire approach, and countries which are a little bit fragmented in their strategies, like what we are seeing in the United States. YY has already alluded to some experience in Asian countries, some of which have done quite well. And I think the other thing that we also know quite well is that in terms of the overall picture of disease severity, it's still fairly true that 80% of the of these affected individuals suffer from about fairly mild disease. 15% probably require hospitalization, and 5% end up with very severe disease, which could make them end up in the ICU. And we also know that of all the underlying conditions, heart disease is your number one comorbidity that makes you much more likely to end up with severe disease and ultimately dying from it. So that's what we know at the moment. The second aspect I want to mention is, what do we know at the moment that we don't know? Okay, and there are a few of these ideas that I just like to highlight. The first one is, we still don't know what is the true transmissibility of this virus. The technical number is something called R0. If someone is infected, what is the R0? In other words, how many other uninfected individuals can he transmit the infection to? At the moment, people are thinking maybe it's around 1 or 2. But if you recall what YY said earlier, this very rapid spread that we've seen in Singapore, for example, some people are speculating maybe the R0 is actually a lot higher than 1 or 2. I've seen figures, maybe it's around 5 or 6. But that's something we don't know. The second thing we don't know is, what is the true mortality rate? What is the proportion of mild and asymptomatic cases versus severe and fatal cases? Okay, and that of course relates to the size of the denominator. It relates to the extent of the testing that different countries are doing. But we still don't know what is the true mortality rate. At the moment, on average, it's probably still around 1 or 2%, but we've seen in some countries it could actually be quite a lot higher. And of course, we also don't know the role of the asymptomatic carriers, which has become very much in the news more recently. And finally, we also don't know what's going to happen when the virus spreads to regions with weak, fragile health systems like Sub-Saharan Africa, India, perhaps, and perhaps also another risk area would be Latin America. Finally, let me just end with the question of what comes next. 3 things that I'd like to mention. Firstly, I think countries need to consider what Minister Balakrishnan referred to as a tripod of criteria that you need to pay attention to. And these are quality healthcare system, social capital, and good governance. Secondly, what does the new normal look like? In my own personal view, I feel this virus is going to become endemic, just like seasonal flu, but with occasional outbreaks of severe disease, maybe due to relaxation of containment efforts, maybe due to virus mutation, we don't know. So we will have to learn to live with the virus, but our health systems must have the capacity to fight fires where necessary. My final comment is that this is the time for international solidarity, where the WHO, the World Health Organization, I think, needs to play and is continuing to play a leading role in the global fight. And this is the time for the WHO to promote solidarity, to promote trust between countries for collective action to save humanity. So I leave it at that. Thank you, James.
Very good. Okay, that's very helpful. What I want to do now is touch on a couple of these issues. So I know that a lot of our audience are watching here in Singapore, and we've got a bunch of questions on the chat group about the situation in Singapore. But I also want to touch on, in a sense, where we go from here and the broader global circumstances, particularly in emerging economies. But maybe, I mean, in a sense, could I ask YY and Joanne whether you agree with Tiki as a starting point that we are heading to a situation in which in most or all countries that this is going to become endemic, because there's quite a variation in approaches. You have countries, I think probably including here in Singapore and countries like New Zealand, where the aim is to eradicate the disease. And so between that and a future in which it's endemic, there's quite a large variation. So YY, what's your sort of sense of this big question of where we're heading, or is it not possible to say at this stage?
So based on what Singapore is putting in place in terms of the national measures, definitely the signaling is still very clear. We are trying to contain this, even perhaps to the point to eliminate completely, which is what countries like New Zealand and Australia are trying to do as well. So this would then allow Singapore to reopen its economy to the extent that people within the country can continue to work. But whether we can allow the country borders to be relaxed, that is a separate issue because it depends on global situations and global factors that is a little bit beyond. But at the moment, I do not think that we are moving towards a stage of mitigation, or as you call it, to allow it to be endemic within the country. So the measures that we've put in place very clearly still signals that we are putting in all the effort to contact trace, to find people as early as possible, the ones that have been exposed, isolate them and quarantine them as early as possible. For the dormitories, equally, the approach right now is really to quarantine those that has been exposed and then to make sure that it doesn't spread beyond. So with this circuit breaker, the intention really is to contain rather than to allow a situation like what you mentioned of endemicity, where it will stay within the country for a long time.
Very good. I want to come back to this issue of the dormitories because we've had a couple of questions on the chat. But Joanne, maybe just what's your view? Tiki sort of threw out this rather depressing view that, in a sense, there's no way of containing this. What's your view?
So my sense is that basically this particular scenario I would defer to my colleagues who are experts in the epidemiology point of view. But I would say from a health systems perspective, what we would see at the end, what I hope to see in the very long run is that maybe 50 years from now, we find that we've reduced it, or with the technology that we developed, with a vaccine potentially in play and with adequate treatment, what we see is a situation where, in fact, we have severe cases that can be treated because we have health systems that are actually able to manage the severe cases that come up. And where, at the end of the day, we are doing exactly what we do with flu today, which is that we urge people to take flu vaccination and they just don't do it. So that would be my hope for 50 years from now.
Why? Come back in on that.
Right. So just to add on what perhaps Joanne has mentioned. So earlier on, I mentioned about the elimination strategy, but it is important to note that the elimination strategy is a short-term strategy. It doesn't mean that Singapore will forever be free from the coronavirus. I'm looking at the very short term, what can countries do? But in the long term, very likely it will have to be a series of tapping on the brakes, very much like the execution of circuit breaker. Once every 3 to 4 months, we may have to have a circuit break just to allow the health systems to recuperate, exactly towards what Joanne has mentioned, towards a scenario where the vaccine will be available, which will be a much longer term strategy. Over back to you, James.
Very good. Let me ask a couple of questions about Singapore, because on our from our audience. So we have one that I think is from one of our own professors, Kai Hong Hua, who is asking about foreign workers and how country health systems deal with foreign workers, and a couple of questions from people basically saying, where did Singapore make obvious mistakes in this issue of the dormitories? And in a sense, what can be done about this now? Because that does seem to be the heart of the problem here in Singapore. So Wai, let me turn to you on that, and then I'll ask Tiki maybe if he has views on this as well.
So thanks very much, James, and thanks, Kai Hong, for the question. I think one of the overarching principle has to be what Joanne and Tiki mentioned, that we have to care for our migrant workers just as anyone in the society, that they are part of Singapore. They have been helping Singapore grow and develop. So this concept of universal healthcare financing to support the migrant workers, if they're infected, has to remain. And I'm very glad to see that the Singapore government has stayed true to that promise, that any migrant workers that are contributing to Singapore, if they're infected, all financial expenses for their treatment will be covered. So that remains one of the hallmark, which is a necessary response, not just for Singapore, but for countries such as Thailand. Equally, I know that they have put in place the financial support to manage any migrant workers in Thailand if they're affected by coronavirus. So the promise of universal healthcare has to be there as a safety net for the migrant workers. So that's the first. The second really is around what can we do for them right now. The reality is that a substantial number of these dormitories, there is widespread transmission. Now, right now, what Singapore has done is to gazette some of these dormitories as isolation facilities effectively, meaning that the entire dormitories have been quarantined. There have been criticism whether that there is this double standards of why are we doing this, quarantining entire buildings or entire blocks. I have to highlight that this response is exactly what we have done in Singapore for our own people. It is also the same response that regions such as Hong Kong did. Countries like South Korea, when Daegu was affected, they effectively quarantined the entire city as well. That is a necessary public health response to minimize the spread beyond where the epicenter of the disease is in a particular region. So right now, what we are able to do, what I can see is that they are identifying people, the foreign workers who are healthy, and segregating them to other locations. So they are put in places where now the human density is much lower, reducing the possibility of spread. Equally, that allows the people within the existing dormitories to have a much more spaced out version. Secondly, is actually a clinical response. I know that my colleagues from the National University Health Systems, many of them not healthcare professionals, volunteers, administrators who have volunteered to be trained, and they have now been deployed to help out with the clinical response in many of these dormitories, trying to make a difference to provide clinical support at the dormitories itself. And those are measures that I see that will help the dormitories manage the outbreak. Now, will that be enough? I would think that if we're able to keep continuing what we're doing, which is swabbing and testing as many of the dormitory workers as possible, isolating those people that are believed to have been exposed, and then thirdly, having a clinical team be deployed specifically to care for these foreign workers, I think that will help to improve the situation. But the reality, I have to be frank, things will look very hairy for the next 1 or 2 weeks before they start improving 3-4 weeks later. Back to you, James.
Okay, thank you, YY. Let me turn to Tiki. I don't know if maybe I will move on from the issue of the dormitories to a kind of broader question about East Asia. I've got a number of questions on the chat about, in a sense, why now in particular countries like Taiwan and South Korea have been perceived to be doing so well. Taiwan has now really got no new cases, I think the news was today. And a couple of people have been asking about the vexed issue of testing. And I wondered if, Tiki, you might have a view on in a sense, why Singapore, but also these other countries in the early stages of the crisis did so well before we turn to look forward to the next stages that are coming.
Yeah, thank you, James. Obviously, there are many factors that have contributed to the success of the containment in Singapore, Taiwan, Korea, Hong Kong as well. Clearly, these are economies or countries which have a significant amount of resources, significant technical capacity in terms of doing fairly extensive testing, and as YY said, to quickly, based on the testing, to isolate, to do contact tracing, which was absolutely critical. And sometimes I feel that you need to be a bit careful in sort of saying, you know, what Singapore, Taiwan, and Korea can do. Why are other countries not doing it? You know, Singapore is quite a unique case. You're a small island, you are rich, you have good informatics, you have good healthcare system. You transfer that to my own home country of Indonesia, it is just not the same situation. Obviously, there are other issues. I believe in all those countries that I mentioned, there is considerable trust in government, okay? And Joanne's already alluded to that issue of compliance. In other words, you know, the sort of the tough actions that the government put in place. is not likely to be sort of protested in large public demonstrations from the population. So I would think that sort of social capital that Balakrishnan referred to. So that would be a second factor in its success. But once again, it's not necessarily transferable to other countries in East Asia, which may not have the resources, may not have the level of social capital, may not have the governance structures that are necessary, like Singapore's interagency, interministerial task force. That's just a model of coordination, of synergy of action, of everybody speaking with the same voice. That did not happen, for example, in Indonesia. Hopefully, after today, it will.
Let's turn to this broader question of where we go from here. A lot of questions about this as well. So a couple of you used the phrase the new normal. Joanne, if I can turn to you first. You alluded in your introductory remarks to the question of, in a sense, what happens when people get fed up doing all the things that the government is telling them to do. It's been quite difficult to get people to follow instructions here in Singapore or in Europe or North America. So looking forward, what is the task facing the governments as they try and persuade people to adopt certain kinds of behaviors that are going to be necessary to manage this pandemic as we wait for a vaccine?
Right, thanks, James. I think at the end of the day, behavioral fatigue or decision fatigue is something that I think most governments were very concerned about when they started putting these measures into place, and I think was a driver, for example, of some people say of the delay in the UK strategy. And it's a very real concern that we have that, with that Samuel Beckett said, I can't go on, I'll go on, right? There's a limit to what human endurance can take. On the other hand, there are many examples throughout history of what it takes to lead through effectively what is a siege. And what we understand and the lessons that we're learning today are that governments need to, first of all, base themselves on a platform of trust. And so when you don't trust, taking directions for a short period of time because you're under a lot of external pressure, right, is very feasible. But in the long run, when we're faced with these very radical uncertainties, at the end of the day, having institutions in which we trust, that we believe are transparent about the unknown unknowns and how we're managing those is actually going to be critical. Secondly, I think the expressions of empathy are going to be part of the new normal of policy communications. We're going to see that these social compacts, which are based on very heavy-handed government intervention, are really no longer going to be sustainable in the long term. And last but not least, I think very basically, we're going to have to see policy interventions that are evidence-based, that are clear, that are simple, that are easy for people to take on board, and that basically help people remember the long term. And that at the end of the day, 50 years from now or 100 years from now, there will be something that is beyond the short-term need to basically break out. So giving, I think, communications, again, that have high levels of clarity, high levels of trust, but express empathy and relatability is actually going to be very key for people to understand that, today, as I think what Wai mentioned, we have to comply with these very strict measures, but it's not a sprint. It's going to be not just a marathon, but perhaps a series of repeated sprints. And we're going to have that mentality as we go forward.
Right. Okay. That's a very nice way of putting it. So Tiki, you've got your hand up. I mean, but basically I wanted to ask Tiki and Wai a number of questions that have come in on the group, but they all boil down to the same thing. So we have Sarang Abbasi asking us, how long are we going to have to continue with this long lockdown situation? Abdul Latif saying, what should be the exit strategies for getting out of the lockdown and restricted movement? So Tiki, you had a point that you wanted to make, and maybe I can ask you your view on, in a sense, what kind of framework we're heading to in the way that Joanne talked about, maybe not a sprint, but a series of relaxations and then tightenings. What's your sense of how we're going to unwind this? And then Wai, I'll ask you the same question.
Yeah, I was just, before I answer that question, just going to ask to add to what Joanne mentioned. I think in addition to sort of a top-down government hand in very firm actions and strategies, you need to complement that with a bottoms-up, more grassroots kind of approach. And that's being shown in Indonesia, where community leaders, together with religious leaders, play a very important complementary role from a bottoms-up, sort of grounds-up kind of approach. So you need both. In the context of what you just asked, what sort of criteria would you look at before you sort of relax or lockdown? I think, to my mind, there are a couple of things here. The obvious one, and I'm sure YY will probably say the same thing, you must, and once again, going back to what Joanne highlighted, the importance of evidence, you must have evidence of controlled transmission. I think that is probably the most important criteria over a certain period of time, depending on the situation in your country. Secondly, your healthcare system must be ready to deal with any sort of adverse events should taking your pedal off the gas cause more problems down the line. So the readiness, once again, we go back to the health system. And the third dimension is continued evidence-based, transparent, and timely communication to the public. That would be my 3 responses.
Very good. Why? Can you sort of take on that big picture question, but also sketch out some of the techniques that certain governments have been talking about, the passports and certificates that we may require, and give your sense of what might be needed in order to create a new framework in which something approaching normality can return?
Right. So there were 2 questions there. One was actually along how long would it be before we can unlock? How long would be this global lockdown? And the second question is around what is the exit strategy, to which I will address a little bit about this immunity passports or serology certificates. On the first question on how long would the lockdown, I think this really depends on when the leaders of various countries are able to come together to coordinate a global lockdown. Because what we are seeing right now happen in parts of Europe, in America, it's that countries have unilaterally decided to impose restriction measures, which we call a lockdown, and right now they are unilaterally unlocking. This staggering approach, it's not going to help the global community, because what is likely to happen is what we are seeing in China, South Korea, Singapore. We will see second waves of importations come in to countries like Italy, like Spain, like Austria, Germany, as they decide to relax some of their measures. Now, of course, it is important to nuance this very carefully, because relaxing these measures, all of these countries have actually very sensible politicians and leaders thinking about how to relax. Clearly, it will not be a case that they can move from a total lockdown to a situation where it is completely the same as it was in early parts of January or December and before. But this comes to the exit strategy that I'll talk about. But in terms of how long will this lockdown last, what we are seeing in Singapore, what we are seeing in China is indicative, because China right now still imposed border restrictions, limiting traveling into the country, into China, because they are just as afraid that foreigners, not citizens, but foreigners coming into China will bring with them additional infections that will go on to see the second, the third, and the fourth subsequent waves. So global coordination really is important and necessary when it comes to easing some of these lockdown measures. Prime Minister Lee today talked about how ASEAN should come together to think about how we will manage this easing as well. And I really see this as the only way that the world can shorten this pain, the economic pain that many countries are suffering. Unfortunately, right now, there hasn't been global coordination in this front. Right, I do see that the International Monetary Fund and the World Bank are convening this week to discuss some of the economic strategies. Equally, G20 a couple of weeks ago talked about a moratorium on debt financing for countries, on debt servicing for some of the countries. That is a good sign, because it seems like the international community are starting to come together to formulate economic responses equally as well as to formulate global responses. We need that, and the World Health Organization has to sit at the heart of it to provide the technical responses in terms of what are the health impact and consequences in terms of how to unlock and the measures necessary. So let's move on to the second point, which is on the exit strategy. What then will be the exit strategy? Many exit strategies have been proposed. Let's discuss very quickly on what James you have mentioned, which is really around this immunity passports. So the immunity passports revolve around this concept that individuals who have been exposed and been infected with the coronavirus, the body recognizes the virus, it develops some degree of antibodies that for a short time, it makes the individuals immune to reinfection. This is the popular belief. There are two unknowns here. The first unknown is what kind of infection is necessary to trigger a substantially strong immune response to generate large amount of antibodies. So would a mild infection be sufficient, or would it require a significant infection that people are hospitalized with particular types of symptoms and so on? That's the first. The second is we don't actually know right now how long this immunity lasts for. We know that there may be some antibodies that will protect, but is it protecting for 3 months or for 3 years? We know from SARS that the protecting immunity seems to be present after 2 to 3 years from the point of infection. But is this going to be the same for COVID-19? We don't actually know at this point. So this concept of having an immunity passport, where if I now test positive for the protecting antibodies, I can then have a passport or a bracelet that says I'm free, I can go back to work, I can travel. It is dangerous on that front that because of the unknowns that I've talked about. Equally, there will be problems if people with this passport is deemed to be eligible to return to the economy, to return to work, because the economic driver becomes extremely powerful for people to start counterfeiting or coming up with fake bracelets or certificates so they can return to work. Equally, there's the possibility that if there is this immunity passport, people will start to come together and get exposed and infected, very much like chickenpox party, just because after this period of infection, they can go back to work and earn a necessary living for many of these people. So I actually think that there are massive ethical issues involved when we start to think about this immunity passports, as well as operational issues, not to mention the scientific unknowns that I mentioned earlier on. But if not the immunity passport, what kind of exit strategy? What I can think of is really very much reliant on having this herd immunity achieved through a vaccine. Now, people talk about herd immunity. There are two responses, actually. You can achieve herd immunity through a vaccine. Equally, you could achieve herd immunity, perhaps like what some of our northern European countries are trying to do, letting people get exposed and then subsequently recover from it. So I see that the vaccine is a viable exit strategy, but that is a long term because that is an 18-month to 24-month exit strategy. In the short term, I realistically see that the natural response has to be a series of locking and unlocking, as well as having a global response on how do we identify countries where we are able to continue trade to allow economic activity to resume to some degree. Identifying which are the essential sectors. It could be agriculture, it can be manufacturing, that can be first allowed to resume before general tourism can be allowed. But those are my thoughts. Very happy to hear what Tiki and Joanne have in mind as well. Over back to you, James.
Very good, thank you for that. Now, a number of you have asked questions on the chat about economic matters, which I think, given although we have one economist, are mostly health professionals, so we're not going to turn to the economics of this, but I want to just press on this a little bit more. So Joanne, I wondered if you had any thoughts on in a sense, the exit strategy of kind of unlocking and then relocking, and how challenging this is going to be from a a kind of government communication point of view. And then Tiki, we've had a number of questions on the chat about the role of the WHO, and I wanted to ask you about that, given you're our resident WHO specialist. But Joanne, do you want to follow what YY said about the exit strategy and how you see that looking?
Sure. I think YY is absolutely right in the sense that having worked in health technology for quite a while now, I think our best chance for an exit strategy lies in a vaccine. And we have, at this moment, if I understand correctly, 80 candidates actually for vaccine. I think what's actually quite surprising to many people is how long it takes for a scientifically valid process to produce a vaccine. And so again, we are looking, even if we have 80 candidates in contention today, we are looking at an 18-month strategy realistically. I think the problem with a stop and start strategy is that from a business point of view and a continuity point of view, managing that risk, especially when stopping and starting is very uncertain, from a supply side point of view, is very challenging. So although I would say that from an epidemiological point of view, that's what we're going to need to see, I think from an economic point of view, it is going to be very challenging. And so, and they do say economics is the dismal science, such as reality. But I think that where YY is on the exit strategy is actually spot on.
Very good. Tiki, I don't know if you have thoughts on the exit strategy, but I also wanted to ask you about the WHO. It's come under a lot of criticism from various sides, partially for geopolitical reasons. It's being criticized by President Trump, amongst other things. But we had a couple of questions, one from Aaron Banks, another from another one of our participants, Nidhi Mehta, saying, is it going to be possible to strengthen the role of the WHO even beyond how you assess its role so far during the crisis, which was Aaron's question. So do you want to take a bite out of both of those questions?
Yes, I have some views on the exit strategy, but in the interest of time, let me just focus on the WHO. I think my main point here is there's a lot of misperception about what the WHO can and cannot do. What it cannot do is to send 100 doctors, 100 nurses, 100 ventilators, 100 field hospitals halfway around the world in 48 hours. That is not its function. It is not an emergency response organization. What can it do? Its strengths are its convening power, as YY alluded to, coordination, convening governments to try to act together in international solidarity. The second key function is to establish norms and standards. In this particular case, the international health regulations. That's what it does best. Thirdly, technical support to countries. And finally, acting as a clearinghouse for information, reliable, vetted, accurate information. So I believe that I think a lot of people do have misconceptions about what it can and it cannot do, and probably applies more broadly to the UN system as a whole and multilateral organization. As Ban Ki-moon famously once said, the United Nations did not exist to take us to heaven, but to prevent us from going to hell. So I leave it at that. I'm still a passionate believer in the value of the WHO.
Let me just ask you a follow-up, which is, so one of the questions was, is it possible that the WHO will end up being strengthened at the end of this, or in a sense, although this is not we will have a subsequent meeting on geopolitics in US-China, but in a sense, is the WHO sort of fated from this point to end up as a kind of football being kicked around between the big powers? I mean, what's your sense of the WHO's future?
Well, I think when you say strengthen, you could say strengthen in terms of having more resources. It has had zero growth in its budget for the last 10 to 12 years. Countries are not providing enough resources, and yet they are asking the organization to do more and more. So that's one way of looking at strengthening. The second thing is, can you strengthen its ability to enforce certain of the instruments like the international health regulations? And the reality is the WHO is not a supranational organization. It cannot punish or put sanctions on countries if they don't comply with certain articles of the regulations. What it has more than, in fact, the only thing it has is moral authority. So it relies on countries' solidarity to sort of say, hey, we're all in this together. Maybe there could be mechanisms in the future where WHO could have some sanctioning powers, but that's sort of a bit of an aspirational idea.
Let me just take one final question from, in a sense that we said we'd cover, then I want to take a few rapid fire questions from the audience that I've got here, including our own Dean Danny Kwa asking about the lessons from the 1918 flu pandemics. I don't know, Tiki or YY, if you're particularly experts on things that happened more than a century ago, but we'll try you on that. But I wanted to come back to this question of emerging economies. So we're sitting in Singapore, but we are in a region that still has a large number of poor and lower middle income countries where this hasn't really begun yet. YY, both you and Tiki have alluded to the risk of what might happen in emerging economies. On the other hand, it hasn't quite happened yet in large countries like India, and so there remains a hope, perhaps, that the extreme measures that governments like Narendra Modi's have taken may be able to forestall this. So YY, and then maybe Tiki again, could you just talk to us a minute about how alarmed you are about the situation in the poorer emerging economies like India? And in a sense, does that play into the way that you're thinking about this as a series of waves going around the world? YY, starting with you and then Tiki.
So at the moment, I think we have seen that the numbers in countries such as India and Indonesia have been rising fairly rapidly over the past couple of weeks. And we really need to understand that the rise in the numbers, was it because that right now they're starting to test a lot more, whereas in the early beginning, perhaps they weren't testing as much? And having the ability to test now will provide a much more accurate picture of what is happening in some of the countries in Asia. And I see this as absolutely crucial for us to understand to what extent is the coronavirus spreading in these countries. Because there is always the fear that countries in South Asia, in Southeast Asia, may become the next epicenter after America is able to get its situation under control. Because when we start to see which countries have very rapidly rising numbers, it is exactly countries in Southeast Asia and South Asia that we start to see that trend. What has happened is really this distortion of global news as well, where there's a lot more priority being placed in European countries, in North American countries, but it seems that the world has not been following what is happening beyond the top 10, 15 countries in the world where that is suffering from the coronavirus. If we see some of the statistics, the trend that it's coming up from countries in Asia, it does suggest that the epicenter is likely to shift again back to Asia. And that is of great concern. And Singapore being in Southeast Asia, being part of Asia, we have to watch this space very carefully.
In a sense, I presume underlying your prediction in the beginning that this was going to become a kind of endemic global phenomenon is an assumption about what's going to happen in these large populous emerging economies. But give us your view.
It's me, you want?
Yep.
Okay, I'm just going to quickly complement what YY said and focus on Africa in particular. I'm going to be a little bit more optimistic here in the sense that from my own contacts at CDC, for example, in the US, there is actually a view that African countries are probably quite well prepared for what might come their way because of their experience with Ebola. This is something that they're quite, I think, both psychologically are prepared for. They know what might be coming their way. Someone at CDC told me that there is actually there is more testing capacity in Africa than there is in the whole of the United States. That's quite an interesting thought. Of course, at the same time, it means that they will still need to deal with their very fragile health systems. And going back to what YY said, this is where the World Bank and the IMF, for example, the World Bank has this something called the Pandemic Emergency Facility. That's where I think, once again, multilateral organizations could play a very important role if something happens in sub-Saharan Africa. But I think because of Ebola, they are quite prepared, at least mentally.
Good. We've got about 5 minutes left. My apologies are going to go to people who've been asking questions. I have more than 60 questions, nearly 70 now, and I'm afraid we've ticked off as many as we can as we've gone through. Let me ask a few rapid fire now. So I don't know if you're an expert, but Danny Kwar, our dean here at the school, asked about the lessons from 1918, and that in particular, I suppose, was a 2-year pandemic that had at least 2 or 3 peaks. And so underlying Danny's question, I think, is again this question of how do you cope with sort of ramp-ups and lockdowns? So do you have a sense of that? And then there was one for Joanne about the long-term behavioral effects of this, which I'll come to. But why? Over to you.
So I think we could see that from what happened in 1918, which was slightly less than a century, well, slightly more than a century ago, the world actually has very short-term memory. And had it been an impressive event that actually registered on the minds of politicians and leaders of countries, you would have seen that some of the exhortations, the plea from people such as Bill Gates earlier on in 2015 around how the world has to prepare for pandemic wouldn't have fallen flat on the years of many leaders. It is very clear that after COVID-19, the world will need to remember this lesson, and I suspect, given the trillions of dollars that has been put aside to manage this response, governments will have a much longer term memory. But I have to state my worry, because there is always a disconnect between election cycles where politicians are elected for 4 years, 5 years cycle, and the long-term commitment that countries need to make to prepare themselves for pandemic. And if we look at countries that have done very well so far against the coronavirus, and I suspect the electoral system, there will be a striking correlation that countries where there is a much more stable system are able to have a long-term thinking to put in place pandemic responses that will be responsible for protecting the population in the event of something that is very rare, like what we see here. So we need to move beyond this electoral cycle or short-term election cycle to plan for long-term for pandemics. Back to you, James.
I wanted to end towards the end with some more optimistic thoughts. And so I had a question on the chat here about the long-term behavioral responses and to what the good things that we've learned how to do, flying less, washing our hands, these kind of things. To what extent are they likely to stick with us, or are we going to snap back to our old habits? Joanne, what's your sense of that in a kind of broad view of whether some of the more positive behaviors that we've seen during this crisis will stick around?
Well, having worked actually in behavioral economics for quite a while, I think I just want to echo what YY said, which is that we have very short-term memories. So under external pressure right now, we're very good at these behaviors. I actually noticed myself touching my face during a seminar on COVID-19, so that shows you exactly how sticky these behaviors are. My sense, as with habit formation, is a tricky thing. We like to believe in it. We hope that it takes root, and it does for some people. But what's actually most important is that we take advantage of this moment to put in place institutional changes that are commitment devices for the longer term. So my sense is that to the extent that we do see institutional change, we take the moment to strengthen our health systems, the same way that the Sars epidemic in Singapore led us to a better prepared response for COVID-19. We will see changes in the way that we approach crisis management. But will we see changes in the day-to-day behavior of individuals? I think that's a much more open question. The other long-term behavioral effect, I think, is that very often when we think about things like epidemics or pandemics, from a behavioral point of view, because we can't imagine the unimaginable, we believe that it can't happen. And so one good thing I think that's come out of this for other problems, like, for example, climate change, is that we've begun, or at least we have a moment where our imagination is so elastic that we can think about other crises, we can think about things that are going to come at us at a much larger scale later on in our lives, and we can start sort of making sure that we have, again, the institutional structures and the social constructs to make our response in those times actually more cohesive and more effective. But I'm still going to touch my face all the time.
Okay, thank you very much. My clock says 6:16, so we've gone 1 minute over the allotted hour that we gave ourselves. So I'm going to wrap it up there. Again, I'm sorry to the many of you who asked excellent questions. As I said, we tried to get through as many of them as we can. But I'm very grateful to you for asking them. They enlivened our proceedings. So this was the first in an hour series that we're going to be doing at the school. So please do check back. We'll have the next one, which is on, I think, US-China in 2 weeks' time. And thank you very much again to our team here at the school for organizing this, and also for the Singapore Global Network, part of the Economic Development Board, for helping us put this together. I would normally at this point ask you as the audience to give a rousing round of applause to my three panelists, but this is virtual, so I can't ask you to do that. So I'm going to give them a little clap myself and say thank you very much. And let's hope that everyone stays safe out there and look after one another. So thank you very much to my panelists, and thank you to you for watching. All the best.
Thank you, James.
Thank you, James.